And here is your host.
Good morning, Las Vegas, and welcome to A Healthier Tomorrow. It's our final episode of 2025. I am Will Rucker.
I'm Sierra Owens.
And we are so glad that you're here with us today. What a journey this year has been.
A journey, a beautiful one that went by so quickly. I think that's the part that always blows my mind. I remember our first show coming back for the year.
Right.
Talking about setting intentions.
It felt like last week.
It does, truly.
I'm also really happy that you were able to be in studio.
Yes, I'm in person, y'all. I'm able to move around a little bit. I broke my foot. It had me down, but I think it set me down for the right reasons.
Yes. Sometimes we got to slow down, and this is the perfect time to think about that, because even though this is the end of the year, it's also the beginning of a brand new season.
Yes.
And that's exciting. Every ending has a new beginning.
Always. And the circle of it all, and the steps, the highs and the lows are all necessary for the big picture. And so we got to embrace them all.
Absolutely. So we've talked about diabetes. We've talked about heart health. We've talked about youth mental health, maternal support, food security, breastfeeding, chest feeding, everything in between. And I would say the thing that I'm most excited about and impressed by is we've heard from our community about the impact the show is having.
Yes, that is the part that is always so amazing. And even one thing that I'm so grateful for is every person that has sat in here I have connected with in some form outside of the show. So I want to say thank you always for taking me along for the ride, being the connector, being the ultimate plug. And I was so excited for 2026.
Well, thank you for always bringing amazing events, the energy, the curiosity, and for building these connections that really are shifting the culture.
They really are. One of my favorite shows actually was about talking about Chinatown and the reconstruction of that, and even like the history going deep into Reno, and what does that look like, and what can that move, and just seeing the amazingness what's happening around Power 88 over here on the historic West Side, and the opportunity that's coming directly to our people. We have amazing things.
That's right, because this is the People Station.
It is the People Station.
Oh my goodness. And we couldn't have done any of this without the incredible team here. So shout out to the team at Power 88.
Yes.
We're so grateful for your constant support, your professionalism, and for persevering even when tough things happen.
That part. And always dealing with the sound. And especially thank y'all for allowing me to call in from far away.
Yes. Me too, because I think I was out of the country a couple times.
You were. We get very creative with the computers and the Zooms, being able to see each other and be able to feed off each other even when we're not in the same space.
Yes, and I've got to shout out all of our amazing guests, our committed partners, and every single person that has tuned in, told a friend, and especially those that are actually taking steps toward a healthier tomorrow.
Yes, there's been so much opportunity, and take it. Before we go, can we make sure we shout out Liliana?
Let's do that.
Liliana, girl, thank you so much for the support that you have for all the guests, all of the thoughtful, intentional work that goes into making sure we have our speaking notes and talking notes and all that. Liliana, we couldn't do it without you.
Could not do it without you. So that's perfect reminder that the Healthier Tomorrow radio program is brought to you by the Office of Chronic Disease Prevention and Health Promotion at the Southern Nevada Health District. Did you know that the Southern Nevada Health District offers HIV testing at various locations? To schedule an appointment, simply call 702-759-1700. That is 702-759-1700, because everyone has a status and we should all know it.
Yes, definitely. We definitely do. All right, so today we have three, not one, not two, but three amazing guests that are really going to allow us to lean into a epidemic, a world crisis, a movement that really needs to be talked about, even still today, even more today in 2025. Would y'all like to take some time to introduce yourselves, please?
Good afternoon, everyone. My name is Chris Reynolds, and I'm the president of the Southern Nevada Health Consortium, and I'm also the HIV Services Director for ASP Cares Pharmacy.
Hi, everyone. My name is Rachel Holbert. I am a health educator at the Southern Nevada Health District.
Hello, my name is Cheryl Radloff, and I'm a senior health educator with the Office of Disease Surveillance, and I also get to work with the HIV Prevention Planning Group. I'm the public health co-chair.
Amazing. Well, thank you all for being here today. And we're devoting the entire episode, actually, to this topic. And I think it's the perfect topic for an entire episode because there's so much to get into. But let's kind of start with just the basics. What does HIV look like in Clark County right now?
Well, that's a great question. And some of the information, in case any of the listeners are interested, there's a great resource. It's called the Fast Facts, and it's from the Office of HIV, and that's with the office, it's with the Division of, what is it?
Health and Human Services.
Health and Human Services, yeah. So what we're looking at within Clark County, and sometimes the statistics tend to be about a year, but, there's a little bit of how could I say this? We're about a year behind. But in 2024, there were 552 people who were diagnosed with HIV in Clark County, and that we had about 12,570 people living with HIV in Clark County.
So hold on, before you go any further, I just kind of want to break that down. So that's more than one person being diagnosed every single day.
Yes.
Yeah.
Mm-hmm. Thank you for saying that. Yeah.
Absolutely.
Yeah. And then the other, just something to be aware of, that in 2024 we also had 187 people who were diagnosed with HIV stage 3. And stage 3 is the term that's now being used, I'd say, in lieu of AIDS or acquired immunodeficiency syndrome. So I think that's really important too, that not only were they diagnosed, some people were diagnosed with HIV, but they were also diagnosed with stage 3 at the same time.
So when we think about stage 3, what does that trend specifically tell us about what is happening inside of our community? Because that is a lot that's heavy.
It is heavy. And what I'd say with that, too, is that I think one of the trends is that for many people, if they're diagnosed with not just HIV, but with stage 3, they probably weren't tested. And so they might have been diagnosed, let's say, in an emergency department. And so we really want to encourage, as thank you so much at the beginning, too, of the broadcast, it's so important for people to know their status. So the earlier you know your status, the better. So especially we can talk to folks, we can get them into care. And the goal is for people to live healthy lives, right? And the sooner you know your status, we can help people get them into care. And I don't know if any of my colleagues would like to elaborate.
I just think that sometimes we have a tendency to not go to the doctor when we feel fine. Mm-hmm. We only go to the doctor when we're really, really sick. And so I think that what these numbers show is that people are being diagnosed very late in their diagnosis, and so or in their disease state. And so it's one of those things where they may have been having problems, they may have actually had symptoms of HIV infection, but just put it off that it was something else. And then now they're really sick and they're in the hospital, or they're in the hospital for something else and they happen to run an HIV test, and that's how they're diagnosed.
Or sometimes you're feeling bad and you tell the doctor you're feeling bad and they don't test you for that. That's one of the last things that come through, because you can advocate for yourself sometimes. And I'm speaking from experience, y'all. Mm-hmm. Advocate sometimes and they're just like, oh, it's your tonsils. Oh, it's this. Oh, it's that. And it's like, no, I think it's something more than me needing to take a nap.
Right. So still people have in their minds what it's hard to believe that over 44 years into this epidemic, and people still think that you can look at somebody and tell if they have HIV. There's still providers in the medical field who think there's only certain people that have HIV, and so therefore if you don't fit that mold, they're not going to talk to you about testing.
That's such an important thing to highlight, is this isn't something that only affects one particular kind of person.
Not at all.
All of us can be affected and impacted by this, and that's why all of us should be being tested regularly. And now, is it true that the rate of HIV diagnoses in Nevada is actually higher than in other parts of the country?
Yes, it is. We're above the national average.
Yeah. See, we can do better, and we should be doing better. And what about Clark County in particular? How are we doing?
Well, I was going to say the other thing I wanted to add to that, Will, is that the CDC looked at 47 counties and regions across the United States, and those areas are what they account for over 50% of the new infections in the country. We're one of those counties.
Wow.
And so we are considered to be, we actually have a higher rate than California. So I think it's something that we really need to think about, is if it's always somebody else.
So let's dig deeper into that demographic of what we think, or not even what we think, what we know is affected by HIV. So the data shows truly that there's major racial disparities, especially between Black and Hispanic/Latinx communities. So what factors contribute to that, and how do we address them?
What factors contribute to that? So we do have what's called cultural mahogany. It's basically when one race of people have sex with the same race of people, right? So we know that Black people love other Black people, and so that can increase our rates within our own population right there. We do know that stigma affects HIV rates in the Black community as well, because there is stigma related to religious beliefs. Many people are afraid to go and get tested and have a positive HIV status attached to their name, right? Because we know our name is very important to us within this community. And so that can be an issue. Let's see. I think just healthcare in general, right? With Black people, many of us cannot afford healthcare on our own, and so we're not being seen by the doctor regularly and things like that. And so it's important that we do have our programs where we come out into the community, like us bringing our mobile testing unit out and testing people at different events in the community and at just different locations as well. We've had like National Black HIV/AIDS Awareness Day here in Vegas, where we bring our mobile testing unit to the community. We've been at Mario's Market. We've been in Nucleus Plaza here over on the west side. So we just try to really help this community.
And to jump in, I think you raised such a good question, too, is that we have been taking I would say that we've been some major changes within the legislature. So a few years ago, back in 2021, there was a bill passed called SB 211, and basically that required all providers to offer anyone 15 and over, would you like to be tested for HIV and STIs? And that was a major bill, just to say, like, just offer it. Because as you mentioned, too, I think sometimes doctors don't ask, or there's assumptions about who might benefit from HIV testing. So really the goal with that is to really encourage that everybody should be asked, right? As you mentioned, too, it could be, how could I say it, to have that conversation. We talk about doing sexual histories, and for, I think there's some assumptions that it can be uncomfortable for providers and for clients, but it's really important to talk to people to be able to get the best testing and to be able to provide the services that they need. So I think we are taking we're making gains on that, as Rachel mentioned and Chris, in terms of outreaches and where people can get testing, and we'll go into that too, that, besides outreaches and getting testing from private providers or from medical providers, there's some really interesting and exciting, I'd say, innovations when it comes to home testing that are emerging currently.
Yeah, I'm going to sound like a broken record today about this everyone has a status thing.
Yes, every single person.
Because everyone does. We really need to be status neutral and understand that whatever your status may be, it's important to know it. So I wanted to just detour a little bit. I didn't see this in the notes, but I think it's important to ask. Talk to our pastors and spiritual leaders out there. What should they know? What should they hear in order to really serve their congregants? And I'm asking because we go to church. That's where Black people go. That's what we do. So, that we socialize there. That's our Sundays. For some of us, that's our 5 days a week, So it is a gathering place for our community. And there's deep reverence and respect when a person in that position says something.
I do want to say that, Rachel and I both do a training. It's called Empower Change, where we train community members how to do rapid HIV testing within, their organizations. And I'd say that we've had several members of the clergy who've taken the training. And there's also, I want to say, with the state, there's been some initiatives to really include, as you mentioned, religious leaders to educate them about what is HIV, how you can acquire it, how it can be transmitted, and then also prevention. And I think that's such a major part. So, but as you all keep mentioning, it's so important. We can't, to move forward in terms of a status neutral, it begins with testing. So you have to know your status. And the idea with that, which I think is so powerful, if your test comes back negative or non-reactive, which means we did not detect HIV at this time, then there's approaches, there's biomedical interventions that can be taken, right, to prevent HIV. So we'll go into that, I'm sure, later, but things like PEP and PrEP and condoms and other just in terms of, we also have some major initiatives through the community in terms of, let's say, safe injection practices as well. On the other side, if your test comes back reactive or preliminary positive, then that's where we have that discussion about getting into care. So again, I love that status neutral. It's like, we want you to come in and get tested, and then we can go from there. And then, again, there are many opportunities of where you can get testing in our community and get the support you need.
Definitely. I wanted to say the message that I would give pastors is that HIV is not related to your morality. All different types of people get HIV in many different types of ways, and it does not make a person any less of a person. They don't deserve any less of your help or any less of your love. And so I think it's important that the pastors, especially in this community over on the west side, we know here in Las Vegas has the most churches within a very small vicinity. And so it's very important that we love on those people and we show them compassion, and also just letting their congregations know that everyone needs to know their status. Like we said, they should all get tested, and that they can work with the health department. Then we can bring our mobile testing unit out. We can come to them and test their congregation for them, and their surrounding community. So pastors are a great resource to us.
Mm-hmm. Thank you, Rachel. I think that one of the biggest things that we're still not talking about is the stigma around HIV, that there's also homophobia plays into that, medical mistrust. And for your question, Will, about what would I say to pastors, is that a person with HIV is still God's child.
Amen.
If God's not going to turn their back on them, why should you? Mm-hmm. So
I love all this. This all feeds my soul and my heart and the conversations on so many different levels. Cheryl, you have touched on before, like as far as it's just the accessibility of testing, including home testing. Talk to us about that. If we have medical mistrust or we feel we can't get to the doctor, what are some other ways that we can make sure that we know our status?
100%. And thank you for asking. We do have a program through the Southern Nevada Health District. It's called Collect to Protect. So if people would like to have a test sent to their home, they can go online and order a test. We also offer other testing as well for gonorrhea and chlamydia. There is a slight charge with that. And also condoms can be sent through that. So they can just go online and sign up for Collect to Protect. And what was really exciting too recently, so all of us attended the most recent HIV prevention planning group meeting, is there's a new test. The manufacturer's been around for a while, and many of the community-based organizations use the test, but it's called Insti. And they have a home test. It takes, I want to say, 1 minute. 1 minute.
Wow.
So it's about, I believe, retail about $44, but you can get a test and you can know your results in about a minute. So that's very exciting. And the other test that's routinely, I'd say, available, and it has been for a while within, I'd say, major, let's say, pharmacies and other retail providers, it's known as the OraQuick. So that is an oral mucosa, or it's like the cheeks. And then you could do a sample. It's 20 minutes, but you can get your results as well. So that is, again, those are both resources that are available in the community. Also, like you said, at home, that's in the privacy of your home. But if you'd like to go, there's so many community providers that do offer free rapid testing that you can know your status in anywhere from, like as mentioned, a minute up to 20 minutes. So
we've talked a lot about testing and about knowing your status. We've only got a few minutes left, so I want to get into a bit of prevention. What does HIV prevention look like today?
Well, of course, sorry, my headphone went out. So, of course, we talk about condoms a lot, but there's a lot of people that say, I don't want to use condoms, or there's always those excuses, it doesn't fit, or I'm allergic to latex. I love all of those conversations.
I'm sorry, Chris, I had to laugh.
Because every time I talk about condoms, somebody says that, I always do a little demo to say, a condom. Yeah, condom goes all the way up to my elbow, and yes. So it's like, okay. And so, I always say that we start with that conversation, and then we move out to other ways. And so there's ways that you protect yourself, which is called pre-exposure prophylaxis, or what we call PrEP. And we now have we start off with having the options of a daily pill, either Truvada or Descovy. You take it every single day. If it is taken every single day, as doctor prescribes, then it's over 99% effective in preventing HIV through sex. Then we, a couple of years ago, we came out with an injectable that is an injection into the butt that is every 2 months. You don't have to take any daily pills. And then in June of this year was the real game changer. And it's a drug called Yeztugo that is, you go into the doctor the first time, you take 2 pills in the office, you get 2 shots that are subcutaneous, in the stomach or upper thigh. And then you go home with 2 pills. And then you don't have to have another injection for 6 months. And so then it's every 6 months that you get those 2 injections. And that is, again, over 99% effective to prevent HIV through sex. And so we have these different options for people so that if people are in a situation where, they can't be open about being on PrEP, and so they're worried about a daily pill or a bottle being sane, then they can have the injection.
We also have something called PEP, and if anybody wants to jump in, it's been around for quite a while. It's called PEP, or post-exposure prophylaxis. And so basically, let's say somebody had a situation occur, maybe a condom broke, or they found out some information. So the idea with that is you want to get on medication, and you need to get on the medication within 72 hours, but the sooner the better. So you'd be on that medication for a month, and it's extremely effective in preventing HIV. And there's also something else that's emerging, I'd say kind of in tandem. We're now approaching, as you heard, status neutral, but we're doing a syndemic approach. You're going to hear a lot more about that. So syndemic approach,
okay.
Yes. So
vocabulary
not just,
day.
I know, right? Love the new term. So when we think about HIV, we also need to think about STIs, hepatitis, TB, substance use, but it's called DoxyPEP. So that is something there. If somebody also is a similar situation, they might have had an encounter and they're concerned about acquiring something like, let's say, syphilis or gonorrhea or chlamydia. They can take medication as well. So we have some exciting things really on the horizon in terms of biomedical interventions to prevent HIV and other STIs.
So
right.
I'm really excited to hear that, because one of the concerns that I've had with PrEP in particular is the fact that because of a low literacy rate, people think, I'm taking this, so I'm protected against everything. And so this is giving the opportunity to protect against, it's not everything, but it is more. Mm-hmm. And so the prevention for me is key. And I actually saw my girl T-Boz singing about this the other day. I was like, okay, go ahead, girl. So tell us a little more, Chris.
Yeah, the good thing about that is that we do have options for people, and it really needs to be what's best for the person, what they want. Instead of somebody telling them, you need to be on this or you don't need to be on this, it's for that person to decide. And so the CDC actually changed the guidelines for who was appropriate for PrEP to where now it includes if they ask for it.
Wow.
Because they know that sometimes a person may want PrEP, may go to their doctor and want to ask them, but is not comfortable enough telling their doctor, because the doctor can say, well, why do you need this? And so now they've kind of tried to eliminate that barrier. I had a friend of mine that went to their doctor, and the doctor, she said, I will never talk to my doctor about this ever again, because he said, PrEP, aren't you married? Why do you need that? And so, is there something going on? Do you need to tell me? And so then it became very much a shame-based. And that is probably our biggest message to people, is that there is no shame about protecting yourself, and there is no shame about living with HIV. We are all here to live our lives, and, sex is a natural part of life, and we also need to be able to protect ourselves.
Could I jump into that? Both Rachel and Chris have been involved. There's been some local campaigns that are very powerful about getting the message out about PrEP. And Rachel, do you want to talk a little bit about She's Well? And Chris, do you want to talk about the campaign that you were part of?
Mm-hmm.
Yeah, so She's Well was a PrEP campaign for women. I don't know if you guys have seen them. They're on the buses that drive by, and also on some of the bus stops. But it's really to encourage women to get on PrEP, because we know that all genders can be on PrEP. And then we also had our Rethink HIV campaign, which was just encouraging people to get tested for HIV as well. And so we had that around the city. And then Chris, tell us about our Live U Equals You campaign?
We have another campaign. A lot of people, the campaign is titled Live U Equals You, but a lot of people know it as the Live Love campaign, because it says like live fearlessly, love fearlessly. And so we have had, bus stop campaigns, bus stop shelters, posters, and I was very, happy to be a part of that campaign. And so they really want people to say, take care of yourself. If you're living with HIV, you can live a healthy life. Go to your doctor. And so it is really about that living out loud. Like you said, we all have a status. And so it's just important for us to know what our status is.
Yeah, I'm really proud because one of my church members is actually on one of the buses. So, makes just shout out because we doing things.
Nice.
We've got about 60 seconds left. And before we close out, I just want to ask just as a reminder, where can people get connected? Where can they go? Tell them how to get connected to the resources.
Well, to begin with, again, I'm a little biased, but of course there's the Southern Nevada Health District. We have
Yes.
2 locations. You can always go to our main location, which is 280 South Decatur. There is something called express testing, so you can come in if you don't have any signs or symptoms, you can get tested. We also have a location which is on the Fremont Public Health Center, which is 2830 East Fremont. I mentioned Collect to Protect. We also have a variety of community providers. So if I leave you out, the people who are listening, just know there's a lot of love in my heart, and thank you for all the work that you do. But we have Can Community Center. We have AIDS Healthcare Foundation. We have Track B, Henderson Equality Center, UMC, their Quick Cares. They offer HIV testing. Dignity Health does amazing resources in terms of their emergency departments. We also have Community Counseling Center. And of course, the center. You have both the Arlene Cooper Community Health Center, which is 401 South Maryland Parkway, and the Gavin G. Gorgon Community Health Center, which is 921 South Las Vegas Boulevard.
Awesome. Well, we really are so grateful that you shared this information with us and this community. Thank you for the work that you're doing and for leading the way here. The Healthier Tomorrow radio program is sponsored by the Office of Chronic Disease Prevention and Health Promotion at the Southern Nevada Health District. With 2026 just around the corner, there is no better time than now to adopt healthier habits. Visit our website at gethealthyclarkcounty.org to find free classes, programs, and events to help you make 2026 your healthiest year yet.
All right, y'all. So as we wrap up the year, please take some time, as our shows have really mentioned, especially within the last month, check on your friends, check on your families, check on your loved ones as we are wrapping up and going into this holiday season. Will, what are you doing? What are you looking most forward to?
I'm looking forward to my baby.
Yes, I can't wait to meet baby girl Aria. It's going to be such a blessing. You and Jay are going to be absolutely amazing parents and super stylish, and I'm just looking forward to it. So, y'all, quickly, what's something you're looking forward to over this winter break?
I'm looking forward to some rest over this winter break. I've been so busy the last 2 months, so I've been nice break, rest.
I'm looking forward to seeing my sister. This was her first year in college. She's up in Reno at UNR, so she'll be home for the Christmas break. Just looking forward to spending more time with her.
Beautiful. Last one.
Just looking forward to seeing friends and family. So I'm going back. I'm from Ohio originally, so I'm going to go see my family. So.
Love it. Love it. Well, this has been A Healthier Tomorrow. I'm your host, Will Rucker.
And I'm Sierra Owens.
And as we always remind you, you are not just a drop in the ocean. You are the entire ocean in a drop. And what you do matters. So live compassionately. Happy holidays. We'll see you next year.
Bye, y'all.